Okay, welcome back, and today we'll be talking about arrhythmias. Arrhythmias, again, another area that gets tested a lot in the GPhC exam. The whole purpose of these videos is to make them quick, straightforward, easy, no waste of time, exactly what you need to know in order to smash this GPhC exam. Again, it's all about predictions. We're not covering every single thing on arrhythmias. I'm giving you the areas that get tested the most in your exam. So here are the key areas that you need to know. Number one, you need to know what an arrhythmia is and also definition of arrhythmias, which is just abnormal heart rhythm. Second thing is you need to know the difference between rate control and rhythm control, and also know what drugs are used in each of them. Then amiodarone is a drug that comes up quite a lot in your exam. Amiodarone and digoxin. Definitely need to know these two drugs. You need to know the side effects, you need to know the doses, you need to know what they're used for. So once you know this, these are the areas that get tested the most when it comes to arrhythmias. So the first thing we want to look at is rate control versus rhythm control, and what drugs are used for both. So with your rhythm control, you're looking at mnemonic dived better. They're going to test you. A question that came up in the GPhC exam was, which of these drugs is used for rhythm control, or which of these drugs is used for rate control? So you need to know your rate control drugs. Mnemonic dived better. So beta blockers, diltiazem, verapamil, and digoxin. These are the ones that are used for rate control. And then for rhythm control, Fabulous Rhythm, FAB, is my mnemonic. So F is for flecainide, amiodarone, beta blockers, propafenone, dronedarone, and sotalol. Once you learn this, that's fine, because you tend to get questions on this. Learn these drugs and at least you're already in a good chance of answering certain questions that may come up on arrhythmias. The next one is something we touched on when we looked at the stroke chapter, and it was knowing your Chart-VASC and your orbit interpretation. So knowing Chart-VASC, able to work it out. The same thing applies to your orbit tool. Interpretation, what each point means. Is there a risk of bleeding? Do you give them anticoagulants or not? Also, so it's definite interpretation. With Chart-VASC, I always talk about anticoagulants, because anything from 2 and above, male or female, requires anticoagulants. And for orbit, 3 makes you bleed. So any patient that has an orbit score of 3 and above, they have a high risk of bleeding, so you're not going to give them an anticoagulant. So just understanding this and knowing how to interpret these results, that's what the GPhC normally tests you on. So next drug, which is so important as a high-risk drug, is digoxin. Again, you tend to get questions from this chapter on digoxin. What do we need to know? The first thing is the side effects. I have a video on YouTube. I'd like you to watch that video, but it goes through a mnemonic that are normally used called 2 kidneys. But you have all these notes again on my website. Go on there, download these notes, read them, and also practice the quizzes on digoxin as well. So diarrhea, dizziness, nausea, vomiting, vision disorders, skin reactions. Your next question in the GPhC exam may be a question on digoxin. You also need to know the reversal agents, because it's high risk, also knowing your reversal agents. So the reversal agent for digoxin is called DGFAB, or it's a digoxin specific antibody fragment. You also need to know what increases the risk of digoxin toxicity. So what makes a patient more likely to get digoxin toxicity? It's to do with electrolytes. So the patient has got a low level of potassium, a low level of magnesium, a low level of oxygen. All of this can increase the risk of the patient getting digoxin toxicity. And also hyperkalemia. The reason why I've left at the bottom is so that you don't get confused. It's too much calcium, whilst for the other electrolytes is less of those, increase the risk of digoxin toxicity. So next one I'm going to look at, I've gone through that slide very fast, but yes, the next thing, once you've learned digoxin, the next thing I want us to look at is amiodarone. Amiodarone, again, a drug that gets tested quite a lot. And the mnemonic I normally use, you need to know the side effects, is Amy is a photogenic female dog. Just being decent here. But you can see my mnemonic is PBITCH. So photosensitivity, bradycardia, interstitial lung disease, thyroid, and that could be hyperthyroidism, and it could also cause hypothyroidism. Again, that could be tested in your GPhC exam. They may give you a set of blood results, and they may be asking you which drug is the likely cause of this patient having a low amount of thyroid hormones. In that case, it will be amiodarone. And then you have corneal ocular microdeposits, flashing, dashing lights at night, and then also hepatic problems. Another important thing you need to learn as well when it comes to this medication is you need to know the dose. You need to know the dose that has been tested in the GPhC exam. So 200 milligrams 3 times a day for 1 week. Then we reduce it to 200 milligrams twice a day for a further week. And then it's followed by your maintenance, which is just 200 milligrams daily. Right, so let's try a GPhC exam question. GPhC style question. So a 64-year-old man has been taking amiodarone for 9 months for atrial fibrillation. He presents to the GP with progressive shortness of breath, a persistent dry cough, and fatigue. His oxygen saturation is 92% on air. Chest X-ray shows diffuse interstitial changes. Which amiodarone-related adverse effect is most likely cause of his symptoms? So which? So the correct answer is B, pulmonary fibrosis. This is the correct answer. So you have all the notes on the website. These are the key areas that get tested. Learn about digoxin, learn about amiodarone, and then all the other slides we went through. Please learn this because these are the most common areas that get tested in the GPhC exam when it comes to this topic. Look forward to seeing you again soon. Hope this helps you with arrhythmias. The main things to know: if you want more notes, more information, I have all of that on the website. We have active recall notes in more detail, and we have quizzes on every single topic. And I also want you to know that you have access to these slides as well on the website. All the best, stay positive, and I'll see you soon.